Hello. Today I'm going to be demonstrating how to administer an IV injection through a running IV line. During your initial approach of the patient, be sure to have your medication order with you and verify the patient's identity, as well as checking the IV solution that is already hanging, noting the type of IV solution it is, and to determine that it is running according to the prescribed rate. You will also be assessing the patient's IV site, checking for any redness, swelling, leaking, or infiltration, noting the patency of the IV site. You will then go to the med room and prepare your medication. Remember, when drawing your medication up in the syringe, be sure to label the syringe with the dosage of medication, the name of the medication, and your initials. After that has been prepared, return to the patient's room, again with your med order, your supplies which you'll need, your syringe that's been labeled with the medication, an alcohol swab, and gloves. Remember your universal steps when you get to the patient's room: hand washing, privacy, body mechanics, etc. Remember also to use a barrier in between anything you bring in the room and setting anything down on the patient's bedside table. Re-identify your patient, checking for his name, patient's name, birth date, and medical record number, and remembering to check if the patient has any allergies. At this time, then, you are ready to administer the medication. Wash your hands and apply clean gloves. Also remember, in the medication area, you are determining the rate at which you will be administering the medication. So for example, I have drawn up 5 milligrams of Reglan that I'll be administering over 1 minute. The Reglan is 1 milliliter. 5 milligrams equals 1 milliliter. So I'll be administering the 1 milliliter over 1 minute, which means every 15 seconds I'll be administering approximately 0.25 or 0.3 mLs of Reglan. Cleanse the hub of the injection port closest to the patient's insertion site, remembering to cleanse it thoroughly for 15 seconds. Allow to dry. While stabilizing the port, get your syringe with the medication and prepare to secure it to the injection port using a twisting motion. I am now ready to administer the medication. In order to administer the medication, I'm going to be pinching the IV tubing to allow the medication to freely run directly into the patient's IV without backflowing into the tubing. I've pinched the tubing, and now I'm going to administer 0.3 mLs of the medication while I'm noting the time on my watch. Once I've administered the medication, I can release the tubing and wait for the remaining 15 seconds. Once the first 15 seconds have passed, I'm going to pinch the tubing again, administer approximately 0.3 of the medication, and release the tubing. So I'm pinching, injecting, and releasing. Okay, I'm going to do that again over the next 15-second period of time. Pinch, inject, and release. Wait for the remaining of the 15 seconds. And now for my last 15-second increment, I'm going to administer the last 0.3 of the medication. Release the tubing and remove my syringe. I reassess the IV site, checking for patency. Remove my gloves. Make sure my IV is still running at the correct rate. and let the patient know that I'll be back in 15 to 30 minutes to check on them for any adverse reactions to the medication. That concludes the demonstration of administering an IV push medication through a running line.